What is autosomal recessive inheritance in cystic fibrosis? Imagine a family where cystic fibrosis is present, and understanding how it passes from parents to children can seem complex. Autosomal recessive inheritance is the key concept here. It means that a person needs to inherit two copies of a mutated gene to develop the disease. In cystic fibrosis, this gene is called the CFTR gene, which is located on one of the autosomal chromosomes, meaning it is not linked to sex chromosomes. When both parents carry one mutated copy of the CFTR gene, they are called carriers. Carriers usually do not have symptoms of cystic fibrosis because they have one normal and one mutated gene. However, they can pass the mutated gene to their children. Each child has a 1 in 4 chance of inheriting two mutated copies and developing cystic fibrosis. There is a 50% chance that a child will inherit only one mutated gene and become a carrier like the parents. And there is a 25% chance that a child will inherit two normal copies of the gene and not have cystic fibrosis or be a carrier. The CFTR gene produces a protein that helps regulate the movement of chloride and water in and out of cells. When this gene is mutated, the protein does not work properly. This leads to thick, sticky mucus building up in organs like the lungs, pancreas, and intestines. The severity of symptoms can vary depending on the specific mutations inherited. Some mutations cause a complete loss of function, leading to more severe symptoms, while others only partially impair the protein, resulting in milder forms of cystic fibrosis. Understanding this inheritance pattern is vital for genetic counseling. It helps families understand their chances of passing the disease to their children and guides reproductive choices. If both parents are known carriers, options like genetic testing and counseling can help them make informed decisions. In summary, autosomal recessive inheritance in cystic fibrosis means that a person must inherit two mutated copies of the CFTR gene to have the disease. Carriers, who have only one mutated gene, usually do not show symptoms but can pass the mutation to their children. This pattern explains why cystic fibrosis often appears in families and highlights the importance of genetic testing and counseling. Always consult healthcare professionals for personalized advice and testing options to understand individual risks better.